As a curious pet owner, have you ever taken to the internet for more information? Maybe you want to know why your pet is itchy and what you can do about it. Maybe you're frustrated about the ear infections. Maybe you're looking for ways to make veterinary care more affordable. Instead of wading through a sea of information that may not be reliable and in some cases may be harmful, here is what your vet wants you to know. I'm Dr. Brittany Lancelotti, board-certified veterinary dermatology specialist. Join me to get the information you're looking for to care for your pet. If you're curious about your pet, then your vet wants you to know. Welcome everyone to today's episode of Your Vet Wants You to Know. I'm Dr. Brittany Lancelotti, board-certified veterinary dermatology specialist at Veterinary Skin and Ear in Los Angeles and the host and founder of Your Vet Wants You to Know. If your dog's been dealing with constant itching, red skin, or repeated infection on their skin or their ears, you know how frustrating allergic skin and ear disease can be. Not just for your pet, but for you too. There's a new medication that's been getting a lot of attention, and it's called Zenrelia. And in this video, I want to help you understand what it is, how it works, how safe it is, and what we're seeing in real-world patients at my clinic. If you want to stay up to date on this and other allergy medications, be sure to subscribe to the channel. Zenrelia is an FDA-approved medication for treatment of dogs with allergic dermatitis, and it works by blocking a key itch and inflammation pathway in the body through receptors on cells called Janus kinase receptors. Now, that might sound technical, but here's the simple version. It interrupts the signals that make your dog itchy and inflamed. Zenrelia quickly helps calm the itch and inflammation that occurs in allergic dogs and leads to those secondary infections on their skin and in their ears. It's important to understand that every allergy dog is different, and no two dogs will respond the same way to their allergies or to their allergy treatment. Working closely with your family veterinarian or a board-certified veterinary dermatology specialist is important to figuring out the primary trigger of the allergies, such as fleas, foods, or environmental triggers, and find the safest, most effective long-term management plan for this lifelong disease. In our clinic, we've started over 100 patients on Zenrelia since it became available, and the results have been very promising. Many of these dogs have tried other therapies like Apoquel, Cytopoint, steroids, or cyclosporin like Atopica or Cyclovance. For some, Zenrelia provided relief where nothing else worked or where the dogs had severe side effects from other medications. For other animals, it was easy to administer, an effective alternative that reduced their symptoms dramatically. And in some patients, it didn't work as well as some of their other allergy medications, so we went back to those. Let me tell you about one of my patients who responded very well to Zenrelia. Rosie was an 11-year-old West Highland White Terrier, or Westie. Rosie came to me for a second opinion for her allergies, and she had been on allergy-specific immunotherapy for 5 years from her primary care veterinarian, grading her itch on a scale of 1 to 10. When she would take Apoquel once a day, which is the recommended label frequency, her itch score was a 9 out of 10. She was absolutely miserable. Now, if she took Apoquel twice a day, which is not the recommended dose on a long-term basis due to the risk of suppressing the immune system, her itch would improve to a 5 out of 10, but she was still not comfortable. Rosie had been licking her paws raw, and she had a serious rash around her chin and muzzle. Her family had tried shampoos, food trials, everything they and their family veterinarian could think of. We started her on Zenrelia and treated her infections, and when she came back for her recheck exam the next month, she was a completely different dog. Her itch score was a 2 out of 10, which is considered an essentially normal dog. She had regrown all of her hair on her paws and around her muzzle, and that redness and crusting was gone. Most importantly, the owners were relieved to have Rosie's happy, funny personality come back. Now let's talk about safety, because as a pet owner, you want to know you're making the right choice for your pet. Zenrelia went through rigorous FDA safety trials before it was approved. And in those studies, the most common side effects were mild gastrointestinal signs, things like vomiting or diarrhea. And those were relatively uncommon in the patients that were using Zenrelia. In a head-to-head study evaluating Zenrelia compared to Apoquel, side effects were comparable, with vomiting and diarrhea being the most frequently reported, but both groups had very similar low levels of tummy upset. What was interesting in this study is that after 1 month, the itch score in the Zenrelia group was decreased decreased by about 68.2%, whereas the itch score in the Apoquel group was decreased by 59.4%. Both groups had a significant decrease in the score of their skin lesions, so the amount of redness or inflammation or crusting that was there, with Zenrelia dogs having a 73.2% decrease and Apoquel dogs having a 69% decrease in their lesion scores. What they also found in this study is that the rate of improvement was similar between the two groups during that first 2 weeks of the study, at which time the Apoquel was being given twice daily, but Zenrelia was given once daily. After 2 weeks, Apoquel was decreased to once daily according to the label instructions. From day 14 on, there was continued improvement in dogs receiving Zenrelia, but the average itch score in the Apoquel group remained the same. By the end of the study, at day 112, about 52% of dogs receiving Apoquel were considered in remission, meaning they had an itch score of 2 or less, whereas 77% of dogs receiving Zenrelia were in remission. Both of these medications are effective for the treatment of symptoms of allergies, but it is recommended to talk with your veterinarian to determine which is right for your pet. In our experience with nearly 100 patients at Veterinary Skin and Ear in Los Angeles, we've seen very few side effects. Most dogs tolerate it extremely well. I always monitor my patients closely, balancing benefits of medications with risks of those medications, especially during the first few weeks when an animal is adjusting to a new treatment. If a dog does develop any concerning signs, then we'll adjust our treatment plan. Because this medication is designed to decrease an overactive immune system causing allergies, we do monitor blood work to make sure Zenrelia is not decreasing the white blood cell counts. In our patients where this has occurred, which is infrequent, none of them develop serious complications from white blood cell decrease, and all of these lab values improved with adjusting the dose of Zenrelia without significant decrease in the effectiveness of the medication. Now, you may have heard that Zenrelia comes with an FDA boxed warning, and that's true. It's important to understand what this boxed warning means. In a very small vaccine response study, dogs on Zenrelia had a reduced antibody response to certain vaccines compared to untreated dogs. In the United States, Zenrelia has a boxed warning regarding vaccines, and it's recommended to discontinue the medication 28 days before and 28 days to 3 months after receiving a vaccine. I think it's important to understand that this boxed warning does not appear on the labels in other countries for Zenrelia. Specifically in Canada, they do have a warning regarding vaccines as a result of that. It's not a boxed warning highlighting a very severe risk. It is something that is on the label with that information. In Brazil, the label goes through the vaccine response study, but there is no boxed warning, and they do not even draw any sort of conclusions as a result of that study. In Japan, the conclusions that were drawn from the study said it is not confirmed if such vaccine take delay might happen with labeled dose administration of this product. However, there may be some risks of vaccine take delay with first vaccination for young dogs. It is recommended to check vaccine take if necessary. There are some different interpretations of the study depending on what country you are living in and the regulatory agency that's reviewing this data. I take a really deep dive into this study in episode 67 of the Your Vet Wants You to Know podcast, which is available on our website or wherever you listen to podcasts. If you want to learn more about this vaccine response study and some of the complications that may have led to the decreased antibody response that was observed, I would encourage you to check that out. Now, this boxed warning doesn't mean that Zenrelia is unsafe. What it means is that your veterinarian should discuss risk and benefit with you, especially around the time your dog is due for vaccines. What's encouraging to me is that following the results of the initial vaccine response study, there was an additional vaccine booster study with almost 4 times as many dogs enrolled that was presented at the International Society of Companion Animal Infectious Disease. This study showed an effective response to vaccines in all dogs, including dogs that were tested with 3 times the recommended dosing of Zenrelia, and there were no serious adverse effects. This warning exists to help veterinarians like me make informed choices for your pet's unique needs. When I'm treating allergic dermatitis, it's never a one-size-fits-all approach. Zenrelia is a great tool, but it's one of many that we use depending on the dog's history, their lifestyle, and how their allergies show up. For some dogs, I will use Zenrelia long-term. For others, it's a great short-term solution during peak allergy seasons. I'm always going to tailor my treatment based on what I know about that individual pet, their lab work, how they've responded to medications in their past, what is their other medical history, and we focus on managing the primary triggers, including fleas, foods, and environmental allergens. If your dog is suffering from allergies and you've been wondering about Zenrelia, here's the takeaway. It is effective in the treatment of allergic itch and inflammation in dogs. It is generally well tolerated with minimal risk of gastrointestinal upset. It is backed by science with numerous safety and efficacy studies that were performed prior to FDA approval. And like any medication, it should be used under the supervision of a veterinarian who is familiar with this medication. Every dog's different, and what works best for one may not work for another, but Zenrelia has been a valuable option in our allergy toolbox. If you want to dive deeper into the science and hear the full podcast interview I did with Dr. Tom Lewis, a world-renowned veterinary dermatology specialist, head to yourvetwantsyouto.com/Zenrelia or listen on your favorite podcast platform. I'm Dr. Brittany Lancelotti, and I hope this video helped you feel more informed about your dog's health. Don't forget to subscribe for more tips, and go ahead and give your golden retriever a scratch behind the ears for me. I look forward to your next visit with Your Vet Wants You to Know.